Hey, it's Dr. Schmidt. So with this video, I'm going to show you how to interpret thyroid lab tests. Now, the number one problem with thyroid lab tests is usually that you don't have enough run on you. There should be a minimum of 10 tests for your thyroid run on you if you think that there's a thyroid problem. Now, typically, in medicine, they only run 1 to 3, and that would be TSH, T3, and T4. That's the main problem with people who have thyroid symptoms and they know they have a thyroid problem, but the lab tests always come back okay. So this is actually my lab test that you're looking at on the screen. And here's the first one. It's TSH. I'm highlighting it. And my TSH is 1.39. That's normal. All right. And then here's the T4, and that's another standard test that's run all the time is T4. And then T3 uptake. That's one thing that hospitals and medical clinics don't typically run is T3 uptake. Here's another one, free thyroxine index. Here's T3. This is run normally. And then free T3, reverse T3, T4 direct. And then these last two are super important, thyroid peroxidase and thyroglobulin antibody. These last two have to do with an autoimmune condition of your thyroid. Now, about 3 weeks ago, I put up a video. I'll put the link right here and at the end on successes with autoimmune thyroid problems. And I have 4 successes that I feature in this video. And what's interesting is 5 hours later, I get this lab test back. I ran this on myself. I had the blood drawn 2 weeks earlier. And I get this result 5 hours after I post that thyroid autoimmune video. And look, I have a high thyroid peroxidase antibody. And so what that means is that I have an organism attacking my thyroid for too long. It's probably black mold. And then the immune system starts to attack the thyroid. And that's the problem. And this happens for a lot of people. And I also have this reverse T3 is high too. So the point here is that there's 10 tests. Now, if I had gone to a doctor, and I've had these run before by medical doctors, and they ran TSH, T4, and T3, and they missed the autoimmune problem. So the standard screening test for anybody concerned about their thyroid is these 10. Now, if you look at the rest of this lab report, it actually has 85 tests on it total. The total cost was $269. So it's very inexpensive. Here's ketones. This shows that I was in ketosis. So now I'm going to show you how to interpret these thyroid labs, and it's actually very, very simple. Now, in regular medicine, what happens is if your TSH is off, they may or may not test T3 and T4. If your T3 is low, they give you a hormone drug. If your T4 is low, they'll give you a hormone drug. And they're treating the piece of paper. They're raising your hormone levels. They're not fixing your thyroid. And if your thyroid does have an autoimmune condition going on, they're not going to address it because there's no drug that fixes it. So what they do is they wait for it to become cancer or something worse, and then they have to take it out. So there's really no therapy for many thyroid conditions that are diagnosed. So you have to think of your lab report as a report card. It's a grade card based on your activities in the previous 6 months. So if you've been abusing your body with bad food, or you got exposed to some virus or toxin that's affecting your thyroid, and 6 months later you feel worse, your thyroid levels are off on the lab report. If you don't address it for 2 years, 5 years, it gets worse, you feel worse and worse. Your grade report is worse and worse. So then with the lab result that you just get now, and you have some direction where to go, and which I'm going to tell you, then you use the lab result as a report card. Are you actually getting better? So that's the first way that you think with these lab results. This is true too for other hormones that they test. Progesterone, testosterone, estrogen. If it's low, they raise it. That's the simplicity of it, and it's actually not very smart, especially when using these synthetic hormones that they use. So, but the way you interpret the lab test properly is by thinking like, okay, something's wrong with the thyroid. What do we do with the thyroid? Like, what do we do with it? How do we fix it? And when you fix the thyroid, it normalizes the hormones. So hormone imbalance is tertiary to glandular dysfunction. Glandular dysfunction is secondary to a cause. So here's the causes. There's three main causes. Here's the mechanism of chronic illness. And then you feed the thyroid to get rid of symptoms. And that's the pattern of any organ. So if you just address the symptoms, or you just address the organ itself without addressing this or this, you're in trouble. And you'll never get better. Okay, so when I see some thyroid levels that are off, I'm thinking, all right, what's wrong with the thyroid? What's going on with the thyroid? Well, I'm going to start backwards and work this way. And there's various supplements to feed the thyroid, and there's many options. I'm going to tilt this down so you can see on this table, I got these supplements that are very specific for the thyroid and other problems that can cause it to not work very well. The number one mineral that the thyroid needs is iodine. So here's a supplement called Organically Bound Minerals from Standard Process. It's a wide variety of minerals, all from real food, with a little bit of extra added iodine, just a little bit. These are two products that are higher dose iodine. Each tablet is 12.5 milligrams. This one's called TMI, it stands for Thyroid Metabolism and Iodine. And this is called Bioactive Carbon Iodine. This has a special, unique detoxification ability. So there's your iodine. Now every cell in the body needs iodine, not just the thyroid. Now let's talk about feeding the thyroid. And just like feeding your body, what's the most important foods? Plants and animal parts. And those plants, you want they're called secondary metabolites. Okay, so the aromas that come from a plant, the noxious chemicals from the plant that they use to defend themselves, the smells that are used to attract pollinators, those are secondary metabolites. That's medicine. So here's an all herbal thyroid complex from a company called MediHerb. And it's got bladderwrack, which is a sea vegetable with iodine in it, and withania and bacopa. So here is another one. This is plants and glandulars in it. It's called GF thyroid. And it's got lung tissue and thymus and thyroid. So it's got more than just thyroid gland in it, but it's got other organs in there. It's got some Irish moss and abutu and pata de vaca. So these are plants in there that feed the thyroid specifically. Now here's a glandular. It's a multi-glandular for women called Simplex F. F stands for female. This pill is 1/4 thyroid, 1/4 pituitary, 1/4 adrenal, and 1/4 ovary. The Simplex M is for men. 1/4 testicle, 1/4 thyroid, 1/4 pituitary, 1/4 adrenal. So it's good to feed multiple organs at once, but sometimes you just want to feed the thyroid itself. Here's thytrophin. It's only thyroid glandular with no extra added hormones. It's got no hormones in it. It's just the cell constituents of the thyroid gland itself. Here's bovine thyroid. This is dried thyroid from grass-fed, organically raised cows in Brazil. And so it has naturally occurring T4 and T3 in it, but it's not been manipulated. This is called Thyroid LF. This is another company, and this is their version of a thyroid multiglandular plus herbs in it. It's got ashwagandha, it's got zinc, and there's the bacopa, bladderwrack, and guju, and there's herbs in here I've never even heard of. All right, now here's a product called pituitrophin to feed the pituitary. The pituitary and the thyroid work very well with each other. Pituitary stimulates the thyroid and vice versa. So if the pituitary is not working good, the thyroid's not going to work good. Okay, I'm going to do a plug for Multiglandular. This is my company, heritageglandulars.com. There are 9 glands in here. There is no thyroid in here. I did that on purpose. So the thyroid just needs a little extra attention and a little extra love. So if you want to feed all your organs and then add a little bit of extra for your thyroid, or maybe you need this one, then you can focus on the thyroid individually. Now, I'm going to move backwards to the mechanism of chronic disease for the thyroid. And there are three main supplements for that. Cataplex B raises energy up and it fixes the mechanism. And so a lot of people with hypothyroidism, they feel tired and depressed. So this helps that. And its brother is called Cataplex G. So people who are hyperthyroid, the G is very calming. Now, for hyperthyroid, that means the TSH, or thyroid stimulating hormone, will be very low. The pituitary releases TSH to tell the thyroid to work harder, and then if the thyroid is working very well, the TSH goes down because the pituitary is saying, okay, no more thyroid hormone. I had a woman who had hyperthyroidism, and we significantly reduced her symptoms of high blood pressure and racing pulse and flushing face within 10 minutes by doing this one, organically bound minerals, with a wide variety of minerals and a little bit of iodine in a very low dose. I think I gave her half a pill and everything calmed down. That was more than 10 years ago. That was in 2003, I believe. 2004, somewhere in there. And she's still a patient, and her thyroid is perfectly fine. She never had it taken out. She never had it irradiated and killed, even though her doctor told her she'd be dead within a week. We were able to save it with nutrients. I'm telling you, nutrition is by far way more important and way more effective than any drug for the thyroid, and you just have to have a good practitioner who knows what they're doing. The third product for fixing the mechanism is a product called B16 from Systemic Formulas. All right, now let's back up to causes. What can cause a thyroid to be dysfunctional? It's a toxin, it could be a pathogen, or it could be excessive sugar metabolism, eating bread all the time, or pasta, or just junk food. And even if you quit that, it doesn't mean that you're going to fix the excess sugar metabolism. I'm talking about metabolism in your body. How do you stop that? Well, that's where you drop your carbs so low, and then you increase your fat and protein, and now you're in ketosis. That's how you turn on your furnace. That's how you rejuvenate your glands, not just your thyroid, but other glands too. A symptom of a thyroid issue is being cold too often, cycling hot, cold, or always cold. Well, ketosis is a really good solution for that. So, but getting back to this, a pathogen, I did a video where I talked about 4 successes related to thyroid autoimmune. And the most common denominator is this product right here called artemisinin. This is from a herb called wormwood, and in 2015, it got the Nobel Prize in Medicine. It was the first time a plant got the Nobel Prize. I mean, it's a bunch of different researchers throughout the world that got the Nobel Prize, but they all focus on this plant. So this has a wide variety of killing power. It can get rid of viruses and bacteria and parasites, so that can help you with a pathogen. Now, regarding toxins, I have 2 of my favorite detox programs from 2 different companies. The one company is called Cellcore Biosciences, and the other one is called Systemic Formulas. So there you go. You have to think more holistically and with a little bit more complexity when it comes to rejuvenating your thyroid. So I've had people where they were able to get off the thyroid medication. But if you've been on a thyroid medication for, let's say, 5 years, or certainly for 20 years, it's harder and harder to get off of that. If your thyroid just starting to fall apart right now, and maybe you've been on the medication for 6 months or up to 2 years, you have a chance to repair your thyroid. If you've had it cut out, there's no chance to repair it because it's missing. If you've had it irradiated, then that's kind of tough to reverse too because it's intentionally been killed, and that's no good. But if you still have your thyroid and you're tired, you're losing your hair, you can't lose weight even though your diet is really good, you still have a chance of repairing your thyroid. So the point of this video is for you to know that if you're going to get your thyroid tested by blood work, there are 10 basic lab tests. Not 1, not 3, it's 10. And you got to get all 10 of them tested. And the other point is that the therapies in the nutritional world are varied. There's a wide variety of them, and they can be complex. You got to have a practitioner that knows what they're doing, and you want to be able to catch this before it's too late. So YouTube has decided to not share my videos anymore. I need you to post this video on thyroid support Facebook groups. I need you to share it to people that have a thyroid problem. And I need you to give this video a thumbs up and comment below. Just say something, say, hey, Dr. Schmidt. And that counts as a comment, and that helps the algorithm. And I think that I've been tagged though by YouTube, so I don't know if this experiment will work. I think that they're not going to let any of my videos go viral anymore because I don't fit the standard model of a drug doctor, and I say things that make the medical profession look really stupid, and I also say things that really piss off big pharma, and I've been targeted by YouTube, and they're just not sharing my videos. I had a video going viral, you may have seen it, and it had to do with this documentary called Root Cause, and that video got 166,000 views within 2 weeks, and then suddenly it just got totally turned off. And here it is a couple months later, and it only has 168,000 views. Whereas 5 years ago, I had a video go viral, and it just started climbing. For 3 years, it was viral, and it has 1.1 million views. But this video about this one, that would have gotten 1 million views within, within maybe 6 months if they had let it keep going. But they weren't going to do that. So if you want these panels run, you have to be a patient in the office. The Thyroid Advantage 10 thyroid test is $125, and if you want the whole comprehensive bioscreen, which is 85 tests, that's $269, and that price is probably a 90% discount compared to what they would charge you at a hospital or at a medical clinic. These prices are cash only, and that's part of the free market. The free market includes an educated consumer and an ethical vendor, prices up front that are competitive. That's the free market. The socialized market is a non-educated consumer. The vendor is unethical and doesn't give you all the information, and the price is crazy high. And then in medicine, it's paid by a third party. That's health insurance. So health insurance is socialism by proxy, and that's why the prices are so high, because you don't know what the prices are. I cut my finger 10 days ago. I got 10 stitches right at the tip of my finger. It's still there, and it was midnight when I walked into the ER. I walked in, I said, how much is this going to cost me? Because I was paying cash. And the woman behind the counter said, I don't know. At 2 a.m., I'm walking out, and I said, how much did this cost me? And she said, I don't know. We'll send you a bill. Here it is 10 days later, I still don't have a bill. That is not free market medicine. And I'm going to get these stitches cut out in a few days by a hand surgeon because I don't have a primary doctor. Is a hand surgeon going to cost me more than a primary doctor? Probably, but who knows? So keeping the consumer uneducated about pricing, that's part of socialism. You know exactly what my prices are before you pay anything to me. That includes supplements and visits, and that's how this practice is set up. That's the way it's been since day one. You can contact the office, and we prefer initially by phone call, but you can email us too. I'll put those at the end of this video, and you can also go below and look in the video description box, and there's a landing page. You can click on that and go to the landing page and get more information.